How do cancer centers treat bladder cancer? When it comes to treating bladder cancer, cancer centers use a mix of strategies that are tailored to the specific stage of cancer and the overall health of the patient. These approaches generally include surgical methods, pharmaceutical treatments, and emerging gene therapies. Each treatment plan is carefully designed to achieve the best possible outcome for the patient. Surgical treatment is often a key component for invasive or high-risk bladder cancer. One common procedure is called radical cystectomy, which involves removing the entire cancerous bladder. This surgery can now be performed using advanced robotic-assisted techniques, like the Da Vinci surgical system. Robotic surgery tends to be less invasive, which can lead to quicker recovery times and less trauma compared to traditional open surgery. In some cases, surgeons also perform robotic reconstruction of the bladder after removal to help restore urinary function. The decision on surgery often depends on the cancer stage. Non-muscle invasive bladder cancer is typically limited to the surface layers, while muscle-invasive bladder cancer has penetrated deeper into the bladder wall. For patients with low-grade, non-muscle invasive bladder cancer, cancer centers often use intravesical therapies. This involves placing medication directly into the bladder through a catheter. A newly approved treatment called mitomycin intravesical solution uses a special hydrogel technology to prolong the drug's exposure to the bladder lining, enhancing its effectiveness. This treatment is suitable for adults with recurrent low-grade, intermediate-risk non-muscle invasive bladder cancer after prior surgery. Recent advancements have even made it possible for patients to administer this treatment at home, making it more convenient and accessible. Immunotherapy and gene therapy are also being explored for patients who do not respond to standard treatments like Bacillus calmette-guerin. One promising option currently in clinical trials is dithalamogene voraplasmid, a non-viral gene therapy aimed at stimulating the immune system to better target cancer cells. While these therapies are still being evaluated, they representing exciting options for those with challenging bladder cancers. In addition to these treatments, cancer centers may also use systemic chemotherapy and targeted drug therapies, depending on the cancer's stage and spread. These therapies can be administered before surgery, after surgery, or for advanced disease. The treatment of bladder cancer is highly personalized. It takes into account the tumor's stage and grade, the patient's health, and their preferences. Multidisciplinary teams, including urologists, oncologists, radiologists, and specialized surgeons, work together to create the most effective treatment plan. In summary, cancer centers treat bladder cancer through a combination of robotic surgery, intravesical drug therapies, immunotherapy, and gene therapies, all tailored to meet the needs of the patient. These treatments aim to effectively remove or destroy cancer cells while preserving bladder function and maintaining the patient's quality of life. Always consult with a healthcare professional to determine the most appropriate treatment plan for individual circumstances.